Like I said, they said what should we do? Signs and symptoms of, we have touched the etiology, right? The causes. We have said improper, in, or having injury from, or the injury caused by unsterilized instruments, death, or contaminated death, and all of that, right? The child can start playing, anything that the child touches and all of that can result to the child can harm himself or herself with a contaminated object. Death could be even a contaminated stick, right? And we also touched on something we said is mark the cardinal symptoms of tetanus infection is that it's also tetanus is also called a lockjaw infection, right? The stiffening of the neck, closure of the teeth as the symptoms, increased body temperature, profuse sweating, excruciating headache, difficulty swallowing because since the teeth become tied during the crisis, it becomes difficult for the person to even open the mouth. So even to swallow is going to be a challenge. So what are we going to do as nurses to handle such a nurses work with respect to the symptoms that they feel, just as we said, administration of drugs as prescribed, reassurance, administering antibiotics, manage pain, right? Administer various medications like antispasmodic drugs and administer strong antibiotics that will manage the condition, right? And also, you give antipyretic drugs to reduce the body temperature of the patient because if the patient gets into a convulsive state, it will destroy brain cells. Every moment a child convulses in the hospital, it results to a death of brain cells. And for you to replenish dead brain cells is a problem. So that is briefly what we have been able to do. That is, we are done with 2021. Tomorrow we are going to be looking at 2022. So briefly, like I said before, go and try as much as possible to understand 2021, 2020, 2020, what came. I said we the section, the MCQ part questions came from virtually everywhere, but the principal areas where question came in 20 in that year is mostly that's pathology. We saw pathology that way that came from various parts of pathology, like some particular causes like the urinary system, the diseases of the urinary system. We saw pathology of the respirator of the circulatory system. We saw pathology of the respiratory system. We saw pathology also of the digestive system. So when you go study, look at that pathology even of the reproductive system, right? And then we saw questions that also came from emergency nursing in 2020. And then 2021, we are seeing a similar case, the same thing appearing. We are seeing infectious diseases. We are even seeing biology appearing. We are seeing they are asking us to draw mapping, genetic mapping. We are seeing questions coming from psychology. We are also seeing questions coming from the disease of the digestive system. Repeating itself, section B is the worst. Disease of the digestive system came more. Same thing, section B, section C, which is long essay question. Long essay question, we saw question also coming from psychology and pathology of the digestive system, right? Because when we're talking about tetanus, right, and all of that, tetanus, though, is not really a pathology of the digestive system, but it has something to do with the digestive system a bit. So take note of those areas where we have seen questions in, and it will help you in that it guides you so that when those pathologies, when the lecturers come and you're teaching, you will also grab what you are supposed to grab. And take note that all of this is to enable you succeed, and it's necessary that as a student identify your loopholes and close them before time. You don't start preparing for HND when it's left for 2 weeks, where you go start paying for classes what I'm doing here is commonly what we also do during that period, because in that period, I myself, I'll be lecturing in some schools too to revise the students, but no lecturer will be able to do as I'm doing, to come and be taking one question, explain one question, answer. Nobody will have that time to do that. They will just rush things and give you speculation, and that they give speculation doesn't mean that they will come. It can fail as well as it may not fail. So think about that. So now is the best time. Start preparing gradually, closing your loopholes as I will be exposing them, as you'll be noticing it, and all of that.